sitting on the speakers bench, aren't you? You were hidden. Yeah. They'll be glad to let you have part of this. Well, hello and welcome. Thanks all of you for coming. We're really excited about this one. I knew there would be a fair amount of interest in this. And I have colleagues who talk about this subject or in talking about this subject will their comments will basically be how straightforward and simple it is. I think the more you know about it, the more complex it is, honestly. But we have two visiting doctors here who are going to shed great light on this today. And so I'm glad you're here to hear it. And we're expecting a lot of questions. This group creates a lively exchange after most of these talks, don't you think? I've really enjoyed it a lot, and I hope you'll. Oh yes, Helen's here. You've been called out. Well, this I think it's a very important topic, complementary medicine and integrative medicine. And they're going to explain exactly what we mean by that. I think you already have a pretty strong sense of it. And what I put on the calendar was, also discussion of medical marijuana. We'll be, the booth to sign up for your marijuana card will be right over here after the talk. Well, let me introduce these two young residents. So, as most of you know by now, we have two resident physicians. So physicians in training out here at any one time. They're here for a 4-week block, and then they move on to another rotation, and two more come and take their place. It's turned out to be a very good process, I think, for the experience they have out here. And I can tell you that just uniformly, their feedback of the experience has been really positive, and I want to thank you all for that, because so many of you have contributed to that in different ways, including just words of encouragement. I think it's so helpful and so important, and I'm very grateful for it. Some of you may recognize the gentleman here, and by the way, I've already been told. She's starting off and she's ending it. She gets the first word, she gets the last word. And Paneeth has just nodded and clicked his heels and done what he, and yet he's the upperclassman here. So Paneeth Thogaropoulos, and I would dare any of you to pronounce that correctly the first time. I'm on about my 200th time and I still don't quite have it. But he's been very gracious about tolerating the way I've mispronounced it. Paneeth is a third-year resident, so he got his MD a few years ago, and he'll be a card-carrying internist next May and go out into practice on his own, or do a specializing fellowship at the end of these 3 years. So Paneeth grew up in. He was born and grew up in India, and then his family immigrated to America. Birmingham? Yeah. And he was in Birmingham. Remind me, I can't remember where you went to college. College and medical school. UAB, University of Alabama, Birmingham, a very fine university medical center, I can tell you. And so I think he's enjoyed Northwest Arkansas. We've made him a believer in Northwest Arkansas, and he's one of our 4 chief residents in the third year, who kind of ordinarily you have some prerogative over this lower classman, but I think she's got the hand up. Chesney Skaggs grew up in Northwest Arkansas. In Brentwood, how many know where Brentwood is? Okay, yeah, south of West Fork, right? Good. Went to the University of the Ozarks. Some of you know where that is. Clarksville? Yeah. And then to UAMS. And she was one of our students who did their first 2 years. They have this opportunity to do their first 2 years in Little Rock and their third and fourth year up here in Northwest Arkansas, and that's what she did. And she's a shining example of the success of that program. We're very proud of her and the others who've done that. So, with that introduction, I'll hand it over to them to walk you through this and then prepare themselves for all these tough questions that are coming. So.
Afternoon. Can y'all hear me? Yep. Okay. Oh, a little louder in the back? Okay. Well, good afternoon. It's nice to see all of you here. This is a pretty good turnout. So Dr. Wright picked this topic for us. This isn't a topic that we were very familiar with, complementary medicine. It's not something that we really talk about in medical school or really even in residency. So this was a learning experience for us as well. So hopefully we all gained something from this. So complementary medicine. What is it? If I can get the slides to work. Okay, so any additional methods outside of medicine, like our regular modern medicine, so medications, immunotherapies, chemotherapies, radiation surgeries, those are all modern medicine. Complementary medicine is about incorporating and using alongside these different methods to make health better, pretty much. So this is a really broad topic, as you can imagine. A lot of things can fit into this category, but we chose to talk about herbs and supplements because this is this is something that a lot of people want to know about and have questions about. And then some mind-body practices also fit into this, and then marijuana, because everyone wants to hear a little bit about marijuana. This is a very popular topic. Okay, so herbs and supplements. If I were to try to do a talk on all herbs and supplements, would be here for a couple of weeks. So I just chose a couple to talk about. Generally, I wanted to give you a little bit of history on the regulation of herbs and supplements in the United States, because I feel like it's very interesting. So back in 1994, Congress passed the bill about the Dietary Supplement Health and Education Act. So this said that manufacturers of supplements have to label the dietary supplements to state this product is not intended to diagnose, treat, cure, or prevent any disease. They also are not allowed to make any direct claims about any diseases, but they can say things like promotes prostate health, supports the circulatory system, is good for your joints, promotes joint health. So they can make claims like that, but they can't make any specific claims. However, one thing that this act also said is that these manufacturers aren't required to provide any proof about efficacy, safety, or quality of the products prior to selling these on the market. So pretty much what that meant was that the burden of proving that the product is safe or unsafe fell on the FDA, and that can only be proven after it's been on the market. So a lot of these manufacturers don't have to prove safety, quality, or efficacy about their products before they sell it to the public. It's kind of an interesting thing that I actually did not know about. Okay, so some common herbs and supplements. So you've probably seen these. They sell them at Walgreens, at Walmart. So fish oil, this is a very common one. It's one of the #1 sold supplements in the United States. They say that they're good for cardiovascular risk reduction. So we'll talk about that in more detail just because it's so popular. And then melatonin, a lot of people use melatonin. I didn't go into a lot of detail on melatonin in this talk, but it's used for insomnia, very common. Ginger, that's been around for a long time. I remember my grandma saying that ginger would help with nausea and vomiting back when I was a kid. And then chondroitin, glucosamine, good for osteoarthritis. That's how they market it. Promotes joint health is what they say on the label. And then a few other ones that you've probably seen or heard about. St. John's wort for depression, and then saw palmetto for benign prostatic hyperplasia. So these are just a few examples. So when looking at this topic, I feel like there's a few things that we need to think about and that you need to think about when you go to buy a supplement or if you're thinking about purchasing a supplement, because these things aren't being looked at before they go into market. So what are the conditions or the factors to consider? Quality. And is the quality present, uncertain, or absent? So that's how we're going to try to decide these things. Efficacy. Is it present, uncertain, or ineffective? Doesn't work at all. And then safety. Present, uncertain, or completely unsafe. And then clinical advice, or just you making a judgment call at Walmart, is should I buy this? Like, is this going to be good for me? Should I think and reconsider this, or maybe should I not buy it at all? And also, these are things to ask your doctor as well. If you would like your doctor's advice on these things, you can ask about the safety, the quality, and the efficacy. Okay, so quality. So it turns out when you don't put a lot of restrictions on these manufacturers and they can just pretty much sell what they like, they can use different plant species, for instance, with different herbs. They can use different plant parts, which is something that you don't really think about. They can harvest differently. They can store them differently. Processing is different and affects the overall product in the end. Standardization, the accuracy of the labeling, all of these things affect the product and then in turn affect how we can use them in a clinical setting. And even if they're safe or efficacious at all, is kind of based on this quality. And then efficacy, so does it work? This is where a lot of herbs and supplements are lacking. Like, we don't have a lot of research that supports herbs and supplements like to show, and I'll go through a few examples. But really what we want to look for are randomized clinical trials, preferably double-blind, excellent clinical trials. And these are hard to come by when you go really digging into the research about herbs and supplements. Okay, so safety is the last factor to consider. And the two components of safety are adverse effects. So how is the supplement going to affect you just on its own? So here are a few examples. So we've got some with the turmeric, which I'm sure everyone's heard about turmeric. It was pretty popular in the news a few years ago even. But adverse effects are nausea, diarrhea, allergic skin reactions, and then kidney stones. And then the other factor to consider for safety are drug interactions. So how do these herbs and supplements interact with the other drugs that you're already taking and that your doctor wants you to take? So for example, St. John's wort. This is one of the important points about St. John's wort, is that it interacts with a lot of different medications because it interacts with the metabolism of the different medications. So it interacts with anticoagulants, antivirals, antidepressants, oral contraceptives, so it actually makes birth control less effective just because how it affects metabolism. And these are things that people don't really think about. They think, oh, St. John's wort, I can take this instead of an antidepressant and it's more natural and I'll be less depressed. However, they don't take into consideration these things. Okay, so the first one I wanted to talk about was fish oil, just because it's so popular and it's been around for so many years. And quite a few people actually take it, and it's prescribed by physicians at times. And there's actually prescription formulations of fish oil. So what is it? So the two active components in fish oil are EPA and DHA, and I'm not going to embarrass myself trying to say those. But those are the two active components of fish oil that have been shown to have some beneficial effects, or that's what the marketing says. So associated uses, effects on lipids, so decreasing triglycerides, which is one of the lipids in our body. Decreasing blood pressure is one of the things that it's been looked at for. And then just overall effects on cardiovascular outcomes. And you'll actually see on the label here, may reduce risk of coronary heart disease, which is a pretty big thing to say if you think about it. But they can get away with it because they say may. Okay, so looking at these different factors for fish oil quality. So there's multiple formulations of fish oil, and between 20 to 40% of each tablet is actually the EPA and the DHA, which are the active ingredients. So that means for every 1 gram of fish oil, you're getting about 200 to 400 milligrams of the EPA and the DHA. But there's several different formulations of that. So that's just kind of like the average. And then it's also available as a prescription, and there's several different prescriptions of fish oil of these active components. But one of the ones that's been the most studied is this top one, the icosapent ethyl, which is about 878 milligrams of a highly purified EPA, so potentially more active. As far as safety, adverse effects, primarily GI symptoms. I don't know if any of you are on fish oil. You don't have to raise your hand. But a lot of people will say that they experience diarrhea, belching, and then bad breath is one of the symptoms or the adverse effects. And then it has multiple different drug interactions, but the most important one to think about is its interaction with antiplatelets, anticoagulants. It can cause an increased risk of bleeding when you're on these other drugs. So that's something to think about. So as far as efficacy goes, what does the research say? That's what we're looking at here. So one trial conducted in 2008, the GISSI heart failure trial, was a double-blind randomized trial, which means it was pretty good. It had about 7,000 individuals with heart failure. And there were two groups. One group was given a gram of fish oil, and then the other, which is the same as the omega-3 fatty acids, you'll see them, they're interchangeable. And then the other was given a placebo. And they saw a small decrease in mortality and hospital admissions in these patients with heart failure. Okay, so then the next study we'll look at is a 2012 study, which was the Origin N3 fatty acid trial, also double-blind, randomized. These are the kind of trials that you want to look for, with about 12,000 individuals with insulin resistance or diabetes. You know, insulin resistance, diabetes really contributes to heart disease, so this is the group of people that they looked at. And then one group got a fish oil tablet, and you can see the breakdown there, or they got a placebo. And then they followed them for about approximately 6.2 years, or that was the median follow-up. They actually found no benefit in cardiovascular mortality in these patients. They did see a moderate improvement in triglycerides, so triglyceride levels did go down. And you'll see that time and time again is that triglyceride levels are affected, but is it really improving overall outcomes? That's kind of the question. And then this trial was recently done in 2019. Also a good trial, or relatively good, randomized, had about 8,000 statin-treated patients, so they were on a statin medication. And they had to have a certain triglyceride level, so it had to be elevated but not too elevated. And then a certain LDL cholesterol, and then some history of atherosclerosis or diabetes. And then they were given that prescription grade icosapent ethyl, 4 grams a day, or placebo. So this is the really high-powered stuff, is how you can think about it. So they found that the median triglyceride level decreased 18% in the treatment group, which is pretty good if you think about it. 18%, that's not bad. And then it actually increased in the control group, so they were getting a placebo. And then the LDL cholesterol levels increased in both groups. So maybe some benefit for triglycerides, maybe some harm for LDL cholesterol, which is your bad cholesterol. And then they also found it reduced the risk of cardiovascular death, myocardial infarction, which is a heart attack, stroke, coronary revascularization and unstable angina, so chest pain. However, the difference was 17 and 22% here. So it reduced the risk. There was some benefit shown, but not a lot. The difference between 17 and 22%. However, there were some limitations to this trial. So it looked good. It looked like a good study. However, mineral oil was used for the placebo group. And there was actually some thought that the mineral oil might have increased the risk for bad cardiovascular outcomes in the placebo group. So it may not have been so much an effect as the fatty acids contributing to good health as the mineral oil, making things worse. And then they couldn't show a correlation between the triglyceride level and how much it dropped, and then the total outcomes. And the thought behind that is that the moderate reduction in the triglyceride levels wasn't enough to account for the 17 and 22% difference in outcomes. And some researchers and people that have looked at this study have thought that maybe the fatty acids are actually have favorable effects on platelet aggregation and the endothelial function and inflammation, and that's actually what reduced the bad outcomes. But we don't really know that for sure. This is just one of the thoughts behind it. So that pretty much wraps up fish oil. So we went through safety, quality, efficacy, and you can see the studies kind of go both ways. One good study shows, it may have some benefit, but then there's some limitations to that study. So overall, can we really say 100% yes, take fish oil? No, I don't think we can. Is it necessarily bad for you? No, it's not necessarily bad for you. And is the quality good? Yes, and there are some prescription formulations of it. So we can prescribe it and ensure that they're pretty good. So overall, should you take fish oil? Perhaps. Okay, and then the next one we'll go through is glucosamine. You may have heard of this one. I've actually seen quite a few older patients take this for osteoarthritis. Sometimes they've heard it is beneficial for rheumatoid arthritis. But what this is just something that's naturally occurs in your body. It's in your cartilage and your connective tissue in general, but higher amounts in your cartilage. And then some associated uses down below. Also has been thought to help with TMJ disorder. But again, on the bottle, you can see it's talking about promoting joint health and comfort. Okay, so quality and safety. Again, multiple formulations. If you go to Walgreens, you'll see 3 or 4 different glucosamines. So there's glucosamine hydrochloride, sulfate, chondroitin. Chondroitin is actually another component of cartilage and connective tissue. And one of the thoughts is that if you combine the two, it's got some better action. Is that me? No, okay. Adverse effects. So they've actually shown that in studies, the risk of adverse effects are pretty much comparable in the placebo groups. So people that were actually taking glucosamine chondroitin had the same amount of adverse effects as people that were taking a placebo pill. So not a whole lot of risk there. Drug interactions, one of the most important one that I've seen in studies is with warfarin. If you're taking warfarin and you're taking this, it can cause an increase in INR, which is not good if you're taking warfarin. So some of the studies about this, I kind of summarized the studies a little more on this one. So there's the GATE trial, so the glucosamine chondroitin intervention trial. It showed that 60% of participants experienced at least 20% pain reduction, irrespective of whether they were getting the glucosamine or whether they were getting the placebo. Okay, so they're like, this pill's really helping, and it was nothing, And then some other studies, just summarizing a few other studies, found negligible effects on knee pain, which is what a lot of patients will take it for because osteoarthritis affects the knees a lot of the times. But they did find that maybe some higher doses, some high-grade formulations of glucosamine sulfate at high doses, so 1,500 milligrams a day, or the chondroitin, glucosamine chondroitin, higher doses, may have some favorable results that were statistically significant but small compared to the placebo group. I feel like I'm hitting you with a lot of bad news. And then the last one I wanted to talk about was this, and this is something I hadn't actually heard about before, saw palmetto. So this is an extract from a fruit of the American dwarf palm tree. Has anyone heard of this before? Okay, so a few people. So associated use, one of the things you'll see it marketed for is for benign prostatic hypertrophy or enlarged prostate. Quality-wise, so this is a big point on this one that wasn't as much of a factor on the other ones. A few studies looked at different formulations of the saw palmetto, and they found that it varied between 3 to 140% in the dosage of what people were actually taking, of what was in the pill that they were taking. So that's pretty wide variation. So you may be getting 3%, or you may be getting 100, or 3, you may be getting 140. That's a wide variation. Adverse effects. So a few of the adverse effects that have been talked about: headache, nausea, dizziness. They've also been generally reported to be comparable to placebo. So maybe not so bad for, maybe you won't have these side effects as much. It's kind of hard to prove one way or the other there. Efficacy. So this is one that pretty much research says don't do it. Okay. 2012 study showed that 32 randomized trials did not find any difference in urinary symptom scores, measures of urinary flow, or prostate size in patients that took the saw palmetto. And then a subsequent 2021 meta-analysis, which included 27 randomized trials, concluded with high certainty that the use of this resulted in little to no short or long-term benefits in the symptoms with enlarged prostate. However, this is still sold and people still buy it and take it. If nothing else, maybe not a good use of money. Okay, so the next section is going to be at mind-body practices, and
All right, so I'll talk about the mind-body practices. So this one includes yoga, meditation, and a few other ones like Tai Chi. I looked at a few studies on this, and most of the data comes from the VA. So a few years ago, when the VA was trying to implement mind-body practices in their system, they did a pretty extensive literature search, and that's the data I'm going to be referring to. So what they found by looking at that is that for yoga especially, it had a lot of improvement in patients with chronic back pain. That's what it showed the most benefit in. It also showed some benefit with depression, and the other ones listed here: anxiety, insomnia, PTSD, and prevention of falls. Those data pointing towards helping with those, but it wasn't enough data to say it definitely helps it. So Tai Chi, I know Butterfield Trail offers Tai Chi here. And so this is the chart from the VA. So the first column are the things that it didn't really show any effect on. So this was diabetes and aerobic activity. The middle column is, there was some data that showed it did have benefit, and then some data that showed it did not have benefit. So it's kind of mixed data in the middle column. And then the last column are the stuff that it did show benefits. And for this one, it showed benefits in fall prevention, so fall prevention, arthritis, pains, And another big part is balance. So if you're trying to work on fall prevention and balance, Tai Chi is a really good way to work on that. So the next part is meditation. So this is a similar table as the previous. So the only one that meditation didn't really help with is fibromyalgia. Everything else, it was either mixed or showed positive benefits for meditation. The most benefits you get is for depression, pain, anxiety, psychosis, and some cancer-related depression as well. And the meditation, they did it in the studies about 3 times a week for 6 to 8 weeks is what they did. And the last part of the mind-body approach is acupuncture. And this table shows benefits and no benefits. And then the row for the table shows data with the highest quality, and then the medium quality, and then low quality. So the best data is for fibromyalgia. So for patients with fibromyalgia and they want to get acupuncture, it actually showed pretty good benefits. Some other ones that showed kind of moderate benefits are for migraines, tension headaches, and post-operative pains as well. There was some benefits, but it was kind of low quality for trigeminal myalgia, occipital neuritis, and some other types of pains as well. And it did not show any benefits for kidney stones, any kind of dental pains, and peripheral neuropathy in terms of acupuncture. So we'll go on to the kind of the bigger topic. So marijuana and cannabis. So marijuana has multiple compounds in it. So it turns out there's actually over 100 different compounds in marijuana. And most of us have heard of THC and CBD. These are 2 of the over 100 compounds. And this is what's mostly marketed whenever you do see or read about marijuana. So the THC compound is actually the one that causes the psychoactive effects. So this is the one that causes memory problems, concentration problems, whereas CBD doesn't cause as many psychoactive symptoms. So in terms of what products can you actually buy when you go to a dispensary? So all of these are products that you can buy. So the number 1 selling item for the dispensaries is what's called a flower, which is on the top right. And they can use these in other products. So it's more of an ingredient. And then the second most selling product is the concentrated formulas. So these are either the drops or the inhalant concentrations. And then the next biggest product is the edibles. So these are the candy, the gummies, brownies. And the last category is the topical formularies. And one of the biggest problems with marijuana is the dispensary, each dispensary has their own kind of formularies, and they have different concentrations of THC and CBD in each of these products. So they not only have all these products, but the concentration of active ingredients are different in each one. And another part of the product is the inhaled products are really fast active, meaning they start taking effect within a few minutes, whereas in the edible ones, they take a few hours to start working. So if you do take an edible and you don't feel any effect, don't take a second one because it's going to compound later on. So it depends on the concentration of CBD and THC compounds in there. And oh, sorry. The question was which one of these is actually addictive? And all of them do have some component that is addictive, but in terms of which one is the most addictive, it's kind of hard to tell because it depends on the concentration of the active components in there. So in Arkansas, you need a diagnosis to get a medical marijuana card. So these are the diagnoses that they qualify. But if you do go on their website, if your diagnosis is not on here, there is a petition that you can file, and they'll likely approve it. So as you can see, this is a pretty big list, and a lot of common diagnoses are part of this list. So if you have severe arthritis, that'll qualify. If you have cancer, glaucoma, Hep C, ALS, Crohn's or ulcerative colitis, fibromyalgia, and severe nausea is another indication for it. And interestingly, the only kind of qualification item on here is the intractable pain, and says you need to have it for greater than 6 months. All the other ones, so for severe arthritis, there's no definition that says this is severe arthritis. So that's kind of up to the physician. Go ahead. Good question. So the question is, how does a doctor know which pharmacy will provide the exact dosage that we as doctors want you to get? Am I getting the question correct? So that's a really good question, and I'll talk to that. I'll give you the process of how to obtain these items, and then I'll talk about that in just a little bit. So the process is you go to your doctor and you say, I want to try these products, and you have a qualifying diagnosis. So they'll fill out a form which is called a physician written certificate form, and it pretty much just has those diagnoses on there. And the only other thing that we fill out on here is how long do we want you to have it. So do you want a year, more than a year, a few weeks, a few months? And what you do is you take this and you submit it to the regulatory board along with an application. And so you need an application, this form, and your ID. And then they'll approve it in, I think they said 14 days. After that, it's up to you where you want to go and which items you want to get. So as a physician, there's no way for us to say you need to get this amount or you need to get this particular product. And you'll understand a little bit more of that as I get into the slides a little bit more. But as of right now, it's completely up to the patient, which one they get, how much they get, how often. All of that's completely up to the patient. So what does the data actually show? So in this, I'm kind of showing the data for pain, which is one of the most common reasons for why patients use medical marijuana. So I'll kind of show you how to interpret this chart, and then we'll go through the charts. I have a few charts. So if it's on the right side, that means it does show some benefit. The middle line, that's a normal line. So if any part of it crosses the normal line, that means it didn't show any benefit. So the squares are the mean values. So the way to interpret this is a few of these studies cross the normal line, which means there's no benefit. A few of them do not cross the normal line, and they're on the right side of it, which means that there is some benefit. And the other thing to keep in mind is the N value, the two columns right beside, which is the number of patients that are enrolled in the studies. So the higher the number, the better the study. And like you saw the studies earlier, which had a few thousand of patients, all of these have less than 100, or most of them have less than 100. So these are very low patient population studies. So kind of interpreting this chart, so it shows that a few of them showed some benefit, a few did not show any benefit at all in terms of pain. The next chart will show overall function. So this is not just looking at pain, but just function, daily functional status. And this one also shows similar stuff, where a few studies did show improvement and a few did not show improvement in functional status. The next chart is looking at a higher THC to CBD concentration. So this is more of the psychoactive substance in these products. And we're trying to look at the same thing, see if there's any improvement in pain. And again, it's the same kind of trend where it shows some of them do show improvement, some do not. It's a very mixed picture. And this last chart is actually comparing two of the products. And again, this also shows a similar picture where some data shows that it does improve and others so it does not improve. So just to kind of summarize all of that data, so this is looking at pain. So the top left of it shows pain severity, and it does show that there's minimal improvement in pain severity with marijuana use. When they aggregated all the other data together, it showed that there's some small incremental improvement in pain. And the graph right below that shows overall functional status. So this is not just looking at pain, but how does that actually improve patient's quality? How does that improve the patient's function, daily function? And again, this also showed small but a significant improvement. So, and the bottom left is asking patients, did you notice at least a 30% reduction in pain response? And about 1.12, meaning there's an additional 0.12% showed that they did have some improvement. So a very small amount of patients overall noticed this improvement. And the ones on the right is all the adverse effects that you can have. So the numbers on the bottom is the likelihood that you will have an adverse event. So for example, let's look at dizziness. So dizziness is about 3.5. So if you're taking marijuana products, you're about 3.5 times more likely to have dizziness. So which is a pretty substantial amount compared to the minimal positive change in pain. And it gets worse for sedation. So sedation's almost at 5. So you're 5 times more likely to have the sedative effects. Interestingly, nausea is also one of the side effects. Nausea, even though nausea is actually indication to give marijuana, it can also be the side effect of it. So let's talk about all the data and kind of poke holes at the data. So the first thing is most of the data that's been done, most of the research, it's looking at THC compounds more than CBD compounds. And this THC compounds is the psychoactive compounds. And there's not very much data for the CBD compounds. So the more safe compounds, there's not much data for that. We talked about how there's very minimal pain reduction in using these compounds. And most of it seems to be with neuropathic pain. So this is the numbness and the tingling or the burning pain that sometimes we can get. Another drawback to these is the studies they all look at certain dosage and they standardize it during the studies. But whenever you go to buy these substances from the dispensaries, each dispensary has their own dosage. So you don't know which dose you're actually getting. And turns out that most of the dosage is higher than the ones that are studied in all of these studies. And the last part of it is the drug-drug interaction. So you'll see a pretty extensive list on the right side, on the left side here, and you'll see a lot of common medications like Tylenol, ibuprofen, metoprolol, calcium channel blockers, warfarin, antibiotics. So taking marijuana substances will prevent the breakdown on all of these substances, so the effect lasts longer. So if you're on a beta blocker, which slows your heart rate, and you're also taking marijuana, the effect of the slow heart rate lasts longer. So, which is another reason why you see patients falling and having dizziness. So let's talk about some adverse effects. So some of the adverse effects are dizziness, like we talked about, fatigue, somnolence, dry mouth, nausea and vomiting. So this one's actually pretty interesting. You can get a syndrome called cannabis hyperemesis syndrome. So these patients will have almost intractable nausea and vomiting, and they'll have nausea episodes up to like 20 times a day. So they're constantly in the bathroom. And a weird thing that people noticed is that whenever you take hot showers, it seems to get better. It's either hot showers or you stop marijuana, and those are kind of the treatments for it. Some other side effects are euphoria, confusion, and hallucinations.
Was that as clear as mud for everybody? So pretty much to wrap this up, complementary medicine, we talked about what it is. Pretty much any method used outside of modern medicine can be considered complementary medicine and used in addition to modern medicine. So we talked about some herbs and supplements. Really, the takeaway from that I wanted you to think about is what you should consider when you go to buy these supplements, or what you should ask your doctor when you go to buy them. There's no way that I could go through every herb and supplement there is. However, maybe that gave you a little idea of how to think about it. And then one of the things that we didn't talk about here, which everyone uses pretty much, are vitamins. So that's considered a complementary medicine. And then mind-body practices, and then the marijuana that we discussed. So hopefully that gave you a pretty good overview of complementary medicine. And then I just wanted to add, the best complementary medicine is exercise. Pretty much in every condition, every study ever performed says that exercise doesn't hurt you and helps you. There's very few limitations for that. So that's something, if you're gonna do one thing for yourself, take a 30-minute walk every day. I'd prefer you do that over taking some of these supplements. Cheaper too. Here are references, and now we're open for questions.
I might just add a couple of quick things. And most of you probably understand this, but maybe not. When they wrote the law about medical marijuana, you can kind of imagine doctors really didn't want to be the place that all this is dispensed or anything like that, and it's kind of part of what led to the format it's got. But one piece of confusion is that doctors, if you need it and you and your doctor agree that it's appropriate for you, that we just write a prescription. No, exactly not. In Arkansas, there are no prescriptions written for marijuana. You've got a card, and you go get it. So the only thing the doctor does is certify that you've got one of the diagnoses on the list of 18. And by the way, I've been telling my wife for 2 years, you don't have a qualifying diagnosis. And then I looked up there today, and lo and behold, she's got one. Uh-oh. I'm going to have to bring flowers home or something. But so that's one thing. And I, for one, frankly, am one of those doctors who's glad we're not prescribing it, you know. I wish they'd gotten some pharmacists in on it, though. I'll just say, I wish every dispensary had to have a pharmacist on hand so many hours a day or something. I had one guy say, you know, the thing that makes me uneasy, I'm going in, I'm shopping around for the right product in the marijuana store. The guy with the most tattoos is the one that's advising me what to get. And you kind of say, now, if you want to really, boo, you do this one, you know, if you want this. I said, oh, my goodness. Yeah, I wish there was a pharmacist there. But, you know, in terms of herbal and supplementary entities that are available. I think many of you have heard me say this, so it's, you know, I'm fairly pragmatic on this. My big thing is, it's a reminder, what they were saying is a reminder that you know, for a company to sell a supplement, it seems like those rules aren't even enforced, because they do make pretty big claims. It seems like I'm gonna start watching these commercials on TV a little closer, because I think some of them really do claim some things. But the reminder for us and for you is that they don't have to have any studies that prove efficacy. My big thing is, I want you to be aware before you get on one of those if there are some safety issues. If this doesn't agree with a lot of medicines, and what kind are they, or any of the ones that you're on, or if you know, half the people get a certain side effects from it, you need to know that. As far as in this category of supplements, as far as whether it's going to help you, if you know it's safe, you can find out whether it's going to help you that by just trial and error. And if at least if you knew it was safe, you wouldn't feel like that's a problem. But a lot of them are not studied enough to really have data out there about side effects. But, yes, sir. You want to run a mic back there?
How many of these questions about efficacy, et cetera, were raised before alcohol was said it was okay? You know, we sell alcohol, and I'm assuming there's some questions like that were also raised about alcohol. And so what I'm saying is, how did alcohol get approved, but it takes more to get disapproved?
Well, not that I know a lot about that, but I know enough about back when alcohol was prohibited, back in Prohibition. I don't think that's the model of qualifying something that we'd want to go through again. But yeah, it is just with recreational marijuana. My issue on that is I just hate the idea that so many people are in jail for simple possession of something that's no worse than alcohol. You know, but you know, the thing about marijuana, by the way, is it is pretty addictive, and especially I saw one interview on TV of someone who's kind of the head of the opposition to it in Colorado, and he was recounting the experience that's happened in Colorado, that once it was legalized, all these companies rushed in and started making this really high-grade, highly addictive marijuana, which can cause psychosis, but certainly addiction, and people committing suicide and things like that. And you know, it's less regulated in many ways. And when they start bringing those kind of high potency products onto the market, it gets really dangerous. And I fear that getting down into our kiddos, and but it's hard to say. I mean, I always kind of assumed I'd be for that if it got on the ballot here, but after hearing that guy, I'm not so sure. I bet there are 100 opinions in here. We could all share them.
Well, I think I have more comments than I do have questions.
We want to hear.
I take a number of supplements and have been for years. And there's a source that I go to when I make my decisions about these supplements, and that is Consumer Reports. Consumer Reports will give you a pro and con breakdown of these supplements based on actual good research. So if anyone wants to check out their supplements, I would suggest that one place to go is Consumer Reports. Another thing I want to mention is the fact that you could take a number of prescribed drugs and break it down exactly as you have these supplements in terms of extremely scary features of side effects. Also, some questions in regard to efficacy and certainly interaction with other drugs. So you can do the same thing with prescribed drugs that you've done with these supplements. And incidentally, I'm not really sure that, except for the fish oil, your choices were good choices in terms of reviewing. And about the marijuana, you haven't mentioned the extremely wonderful results they have gotten with seizures in children.
Oh, yes.
And that needs to be recognized.
Yeah.
And I know where Harris is coming from, because just yesterday afternoon we talked about this business of if alcohol and tobacco are legal, they are certainly some of the most potent and dangerous drugs that we've ever used as the human beings. And why is it that people are so concerned about marijuana? Mm-hmm. So, but particularly, there are some good things. I've never used marijuana, but I know that particularly in regard to epilepsy in children, it's been a wonderful, wonderful thing. Thank you.
Yeah, when I was on hospice, I found a number of patients that responded really well to certain symptoms, especially nausea. And frankly, wasn't even aware that how often it can cause nausea, but quite a number of patients respond well to it for nausea. So thanks for those comments. Yes, ma'am. Okay.
You want me? Go for it. Okay. I just use my doctor's office to check out if my supplementaries are right. When you go for an appointment, they ask you to bring all your medications over the counter also. And I do that. And they actually will point out to me what is not good. It blends with what maybe something else that I am taking, which is, a prescription or another over-the-counter drug. So I just count on them to do that for me. And they've done a good job. I'm still here anyway.
I just have a comment, and this has been my experience with marijuana in Texas. And that is, I had my husband who died was so convinced that marijuana was going to do the trick. He had Parkinson's and died, as I said. The store is very, very, very expensive. I haven't heard that addressed, but it was easy to get all these products. And my husband actually wanted me to try some. I never did because I've had experience also in knowing different people that have been addicted to it. I think in good results, I don't want to, but I can't see on the ballot, it doesn't separate whether it's going to be medical for some kind of good use or whether it's going to be used to let somebody get terribly addicted to it. And also it doesn't say how much it's going to cost. That's my comment. And Dr. Larry Wright, you are supposed to be my doctor when I get everything lined up. And thank you for having this today. It's been a very good session. Thank you. Are we going to be able to have those papers that you, because my eyes are not
Yes,
that good.
We didn't copy them, but you can get a copy from our nurse in the office.
Okay, thank you.
She'll give it to you.
Okay, thank you.
I have
Thank you for those
question.
comments. I'm really glad to know I'm not going to have a patient with an expensive habit. If nothing else, the expense is going to keep you out of that.
I have a question. When we first started hearing about marijuana, it was smoking pot. And my impression was that people did it because it made them feel good. And I think people use too much alcohol because it makes them feel good. But I'd like to point out that food makes us feel good too. And we're not real careful about eating too much of the wrong kinds
I'm
of food.
addicted.
I know, but you know, it comes right down to basic common sense. Get exercise, keep your body moving, live in moderation. I'm going to start preaching, I guess. But anyway, a lot of it's just best if you leave it alone. You know, just leave it alone.
I'll share an experience I had this was a long time ago, and then I won't share a name anyway, but when I was working full-time on hospice for a few years, I had a little lady, a delightful little lady who's just the best picture of a grandmother I've ever seen, and she was about 90 years old, which made all this even more surprising. She wasn't my patient, but I was rounding on her that day. Maybe I'd seen her once before, and at the end of the discussion I was about to leave, I often say, are you getting everything you need? Is there anything I can get for you? And she said, well, I started to say weed. She says, she said, but I know you can't do that. You're not going to do that. And it's okay. My family's bringing in the edibles later anyway. I think she could educate me if I stay in here long enough. Yeah. Yes, sir.
I have one comment. I've been the beneficiary of some medical marijuana. Really appreciated it when I had need of it. The thing that is so sad is that when somebody goes to a dispensary, they're not going to know whether they're getting a lot of this or a lot of that. Is there not? And the doctor doesn't know which dispensary you should go to get what your prescription says to get.
I'm glad to hear you had a good experience with that.
I did. I had a very good experience.
Would you mind sharing it?
Oh, 30. Oh, I had a cancer. I was being treated for cancer, and marijuana was part of my cocktail every 3 weeks. I think it was probably for nausea and just get me out of it so that I didn't experience all of the hard things. And it worked. But I also have to tell you that I went into the hospital, had my drugs, had my treatment, came home, and about 5 days later, I came off of that. And I thought, if this is what it feels like to come off of drugs, it's a scary experience. Every time. There was nothing I could do to make myself feel better until I got through it. But it got me, I was never nauseated. I was never sick. So that was helpful.
I have no doubt in the appropriate person with appropriate symptoms.
Right.
That would be helpful.
Oh, it was. It was very helpful. I think it would have been even worse if I hadn't had that.
Not many of us have much experience with it on the medical side.
Well, this is what scares me is that these dispensaries won't advertise. This is how much is how addictive this is. This is how addictive that is. I mean, people go in there, they're not going to know which they're getting. That's scary.
Does the literature report any deaths from overdose of marijuana?
Well, do you know,
I can comment on that.
I wouldn't, can you comment on it?
Yeah.
Good.
So marijuana receptors, they're not really present in the brainstem like opiate receptors. So taking a large dose of opiates will reduce your stimulation in the brainstem and can cause you to stop breathing. Whereas marijuana, even taken in high doses, does not necessarily cause that. So marijuana, you get a lot more of the psychosis type symptoms than the kind of opiate kind of.
The deaths I've heard about that are scary are suicide. And that's especially true with this high concentrated, high potency marijuana. Yeah. Yeah. No, yeah. It's the truth.
Don't they say that marijuana leads some people to hard drugs?
Yeah, I
Or
mean, I
that-
think that's
that's-
been one of the worries. It's an entry drug into bigger things.
And then with marijuana, there would be the problem of driving and maybe causing an accident or just doing stupid things that were harmful.
I have heard discussion on that very thing, that we're not as aware of the dangers, the impaired functional performance that someone has. I mean, we know how to test that on the street for alcohol, but at least whenever I heard this a few years ago, it sounded like there wasn't a good, reliable, simple way to assess that. So that's a good question. Okay.
I'm just glad that we got to smoke it in the 60s and 70s. It was really cool. We had a lot of fun.
Well, she- Yeah, I was going to say one of the answers to your question about why is it so much worse than or as bad as alcohol when it's not. I think it's all the social, cultural stuff that it's a hangover from the, no pun intended, a hangover from the 60s. You know, depending on what you thought about the 60s, you probably have pretty strong feelings about it.
I'd like to make a comment.
Where are we?
Back here.
Yes.
My husband was in a rehab facility. He had stenosis of the spine. And unbeknownst to me, they gave him medical marijuana, and he hallucinated. He thought the place was a conspiracy. It was scary.
Well, with a lot of medicines that we think of as safe because they're so well dosed and precisely dosed and controlled, you give a little bit off on the dose of those, and you can get things like hallucination. I mean, the nitrous oxide in the dental office, you ramp that up and you got someone nauseated and vomiting and hallucinating or doing other things. So sometimes it's, that's another bothersome thing if it's in a form or a format or distributed from a place that isn't sharing that kind of precise information.
So in one of the slides, there was something about peripheral neuropathy and maybe some benefit. Can you go back and explain that again?
Whenever they looked at, especially in chronic pain, when they looked at the data in terms of which type of pain did it actually help, it showed that peripheral neuropathy was the one in particular that it did show some benefit in. So all of the studies that they have looked at in this, what I showed, the longest term they looked at was 6 months. So we don't have any data past the 6 months. So we don't know what the effect is after the 6 months.
But that's interesting to know that it's effective for certain pains and neuropathic pain. We don't have as many things for nerve pain. We've got gabapentin and sister drug to gabapentin, but if it's, I was interested in seeing those. I hadn't seen those numbers either, but pretty impressive.
So
Yes.
related to that, is there a difference between ingesting it versus a topical cream?
In terms of the topical cream, I didn't really see any data in there. I didn't really look specifically at that. In terms of ingestion versus inhaling, the inhaling medications were a lot more quicker onset, quick on, off. So they probably lasted about 30 minutes to an hour, whereas the edible ones lasted for 10 hours or so. So it was more in the hours. But it takes longer. It takes longer for it to start on, so it takes like 2 to 3 hours.
You're saying edibles versus inhaled, yeah. Okay. Any other questions? Okay. Yes, sir.
If the dosage was ever standardized, it would be more acceptable than it is now, because you don't know what you're getting.
Yeah, I think that's right. Yeah. That's kind of, you said it better than that's what I was trying to say. And I don't think I finished my thought a while ago about supplements and herbs. If someone comes in and asks me about a supplement, I'll tell them what I know about it, but my big interest is going to be, are we aware of any safety issues? Is it, if it's a supplement that I've got a lot of patients taking and I haven't heard any of them talk about side effects that are significant, I'm feeling pretty good about that. You can find out if it works. You can do your own experiment, but so I think there's room to be pretty pragmatic about that. But you do want to know what's known about safety. Yes, ma'am.
Are all states equal as far as testing and standardization, their rules and regulations? Because I have heard that some states had special labs that the product had to go through. I think we don't have those in Arkansas as we're coming up to the election. But I just wondered if states do things differently.
I think they absolutely, on this subject, I've heard a lot about that, that there's pretty high standards in a few places, and most places it's really mixed. So I think we can almost expect that. Yeah. Yes, ma'am.
Dr. Wright, the lady from Texas may not realize Arkansas has passed medical marijuana, and on the ballot is to be the recreational marijuana.
Right.
And subject number 2 has to do with seizures and children. Harris and Helen mentioned children and seizures. I don't want the audience to think that it's causing seizures in children. You have a child who has severe epilepsy and repetitive seizures that you can't control. Data has proven that that will reduce those seizures in the amount, and there are many parents who have moved from a state with no laws
I've seen some of the
to a
stories on
state that legalizes it.
Yeah, I hope everybody's clear on that. It apparently has a beneficial effect for a lot of kids and that's what Dr. Helen was pointing out. A lot of kids with seizures. Yeah.
I may have been misunderstood. Let me straighten that out. It's one of the strong points of using medical marijuana for epilepsy in children because it has just saved numerous children that would have a number of seizures every day, and it would reduce it dramatically. And one of the reasons that I changed my mind a little bit about marijuana was Sanjay Gupta. You know, he is the medical director of CNN, and he changed his mind after studying the subject. He changed his mind from being against the use of marijuana for medical reasons to being a very strong supporter of it for the right things. So I want to come back to the idea that any medication, whether it's prescribed, over-the-counter, supplements that you put in your mouth, it's going to be a double-edged sword some way or another. We need to remember that. The other thing is, I wish you'd talked a little bit more about vitamins as supplements. I have been told that doctors say no research shows that there's any benefit as long as you're getting good nutrition, but most doctors take vitamin supplements.
Well, I do think the first part of that is pretty much the party line for most people, and then there are a few glowing exceptions who really believe in them. I think there's a lack of sufficient evidence base for most vitamins, and then there are a few that have a really good evidence base. I'm sorry? Oh, for macular. Oh, yes. We were just talking about it before we came over here that, the vitamin D, we know the role of that better and getting the blood levels and that everybody needs, that after a certain age probably. And the vitamins that have been shown to be efficacious for eye health in preventing the onset or the progression of macular degeneration. I think that's pretty well established. And then a lot of them, there's some of them, they're strong feeling, but not a lot of evidence. And again, if it doesn't bother a person, I don't object to it. But thank you, everyone, for your input.